Today I'm going to take a 365-degree uh, in my presentation and talk, and coming out of the political arena and uh, touch base in medicine. One of the issues that I have seen recently uh, that uh, dominate the news is the issue of the Alzheimer and the factor involved in Alzheimer disease. As we all know, or we might not know, that Alzheimer is a very unique disease. There are some genetic components that might hit early in life. I have in my career see those that is more genetically inclined at 25 to 39 year. I have been involved in at least three patients that young. Uh, the other has some component of the genetic, chromosomal and gene attachment, and then some environmental element that might be involved in uh, uh, causing Alzheimer's disease. The basic pathology for Alzheimer's disease is reasonably well known. Uh, we were involved in many studies with subsequent publication uh, for the exact pathology, which you might know as plaque and tangle, the amyloid beta and tau protein. That these are the two elements that if they increases and their orientation changes in the brain, uh, might result in the damage to the area that is involved in memory, whether it's long term or short term, particularly in the hippocampus areas. Uh, One of these element is the question is what are the factors that might promote this plaque and tangle forms? Genetic is part. Is it environmental? Has been some evidence, but not much. I remember so many years, and many of you guys might remember many years ago there was this question of the toothpaste might cause the aluminum, which turned to be really not true. In any rate, there are so many tales that we should not kind of look into it or worried about it. We just talk about more science, and the science is now that there are some genetic tendency and predilection, but the end product is beta-amyloid that sits on the neuronal junction and gap and create pathology that we call it Alzheimer's disease. There are different type of dementias. In particular, dementia, or as a general name, a cognitive impairment. Uh, One thing is has been uh, studied significantly is what we call the vascular dementia. The vascular dementia per se is not an Alzheimer, but it's it's promoting the Alzheimer disease, the way I will describe it. There is a pathology called Binswanger, and that's when there is uh, a formation of the hardening of the arteries and terminal vessels that's in the hippocampus areas or across the cortical area of the brain, which cause malfunction of the cell. If if you will, because if the memory is a function, is the cognitive function, which is a number of them, is speech, vision is part of it, is mobility, those things that makes us connect to the environment. If those cannot be delivered, then there is a problem with that global cognitive function. So when there is this hardening of the arteries, and the blood and oxygen doesn't reach, or some of the element, some of the metabolite, and even insulin is involved in some of them. That maybe later on we will talk about this a little bit more. When they don't coordinately function, then there is an impairment, and as a result of that, the impairment of the cognition. And if this is associated with the atherosclerosis, hardening of the artery, is very reasonable to call it vascular dementia. However, vascular dementia per itself is a risk factor causing the Alzheimer, um, and the position of the plaque and tangle. Even recently, there has been some studies that the in obesity and in uh, people who do have large amount of the fat in their bodily structures, and also as part of the cholesterol system, some of the very small, tiny emulsion, that small particle might uh, cross the brain barrier, we call it, go inside the brain, and as a result of that, trigger the trigger the position of the plaque and tangle. Uh, there are some issue with regard to the inflammation and inflammatory processes that also might decrease, might increase, excuse me, the position of the beta-amyloid. So there are risk factors, and there are some other element that might not function as a risk factor, but might be as a disease process. So if the atherosclerosis, if the hardening of the artery, if the small particle of the fat and fatty structures is a factor, then some of the question that could be easily answered is: should we exercise? Should we lose weight? Should we check our cholesterol? Should we make sure our blood pressure remains stable, and we stabilize our blood pressure? These are all questions that the answer to them are yes, yes. So we have to have a lower cholesterol. We have to have a lower body fat. We have to have a lower body mass index as possible. We have to have a normal cardiovascular, or improving cardiovascular. If we are a person with hypertension, we have to make sure that our blood pressure is maintained and stable and stabilized. And then the good news is, now we can measure the plaque and tangle, the component of it. I remember uh, when I was in practice, we had to go through the spine to get the fluid. Still is that part of it, but now there are much easier. Uh, there's much easier methodology to get the results of those tests, and make a diagnosis. We did it then, but we did it in a hard way. Also, now there is this immunological treatment that like a jigsaw puzzle. They go inside the brain. When I was in practice, we were giving it through the vein. These days, they are doing it differently. So there is so much improvement that is like a when it goes, and instead of letting that plaque and tangle sit there, attracted to that uh, hinge, and take it away in the brain. So there are so much improvement. So I encourage you to ask question, ask your physician, ask your primary care, ask your cardiologist, ask your neurologist. They are all aware of all of these findings and they are versed in this. And then seek help and consider being more aggressive in treating your hypertension, treating your blood pressure, and treating your hypercholesterolemia. From time to time, I try to go back to my uh, old career and put the physician hat on and talk to you some of the issue. And I appreciate if you make a comment and ask me question. What part would you like me to explain and explain a little bit more